Myself Parameswaran, Assistant Professor from the Department of ENT. The topic for today is anatomy of facial nerve. Coming to the introduction, this is the seventh cranial nerve and the nerve of the second branchial arch. It is a mixed nerve which has both sensory and the motor component. The sensory component being a nerve of Rysberg, the motor component arises from the facial nerve nucleus. So this is a supranuclear anatomy. So the motor face area is situated in the precentral and postcentral layers of the cerebral cortex. From there, the corticobulbar fibers arises and passes through the internal capsule, which synapses with the facial nerve nucleus located in pons. The upper part of facial nerve nucleus receives the bilateral innervation from the corticobulbar tract. This leads to the forehead sparring in upper motor neuron type of facial nerve palsy. So these are the fibers which arises from the precentral and postcentral cortex, passes down through the internal capsule, which decussate at the level of brainstem and innervates the facial motor nucleus at the level of pons. So once after exiting from the pons, it has a cisternal component which is 24 mm in length, courses anterolateral from the brain parenchyma at the level of pontocerebellar cistern, and it reaches the internal acoustic meatus along with the vestibulocochlear nerve. The facial nerve lies anterior to the vestibulocochlear nerve, the entire cisternal portion. So in this diagram, we can see the facial nerve along with the nerve of Rysberg, which is a sensory component, which is located anteriorly. And below that, you can see a cochlear and vestibular nerve. The vestibular nerve again divides into superior and inferior divisions. Coming to the intratemporal component, which is again further subdivided into a meatal segment, labyrinthine segment, tympanic segment, and mastoid segment. We can see about the meatal segment, which is approximately 5 to 12 mm in length, which extends from porus of the internal auditory meatus to the fundus of the internal auditory meatus. So this is the cross-sectional diagram of the meatal segment. We can see the subdivisions of the facial nerve, subdivisions of the vestibulocochlear nerve and the facial nerve. So facial nerve is located anterosuperiorly in the canal, so which is divided from the superior vestibular nerve through the Wills bar. Again, this facial nerve and the cochlear nerve are separated by the falciform crest. Coming to the labyrinthine segment, which is approximately 3 to 5 mm in length, and it has the narrowest diameter of 0.68 mm. So this is the most important segment because of the lack of anastomosing arterial cascades, and which is more prone for embolic phenomena, and due to low flow rates and vascular compression in this lead to the formation of resulting in the cause for the Bell's palsy. So it is the most common segment likely to be injured in temporal bone fracture. So coming to the geniculate ganglion, so your labyrinthine segment ends in the geniculate ganglion. This geniculate ganglion, you can see in the picture, it is marked with asterisk. So from the geniculate ganglion, secretomotor fibers emerges. We have the greater superficial petrosal nerve. So the greater superficial petrosal nerve is preganglionic parasympathetic fibers which arises from the geniculate ganglion and traverses the hiatus on the anterior surface of the petrous part and reaches the middle cranial fossa, and which leaves the middle cranial fossa through the foramen lacerum, joins with the sympathetic plexus around the internal carotid artery from the deep petrosal nerve and forms the Vidian nerve. This Vidian nerve gives secretomotor fibers to the lacrimal gland and the nasal mucosa. So after this geniculate ganglion, horizontal segment of the tympanic nerve arises. So coming to the tympanic segment, which is approximately 8 to 11 mm in length, it runs along the superior edge of the medial wall of the tympanic cavity. So the most common importance is it has a developmental dehiscence, so which results in the injury during the middle ear surgery. So in this diagram, you can see the meatal segment followed by labyrinthine segment and geniculate ganglion, and this horizontal part which is related to the oval window inferiorly, and lateral semicircular canal is related to the second genu, and followed by that you can see the vertical segment or a mastoid segment of the facial nerve which emerges through the stylomastoid foramen. Coming to the mastoid segment, so it is the longest intratemporal segment, which approximately 10 to 14 mm in length. It runs vertically downward in the posterior wall of the tympanic cavity and the anterior wall of the mastoid from the second genu to the pyramidal process to the stylomastoid foramen. It has 3 branches which includes nerve to stapedius, cauda tympani, and the sensory auricular branch. So the nerve to stapedius arises near the pyramidal eminence and gives a supply to the stapedius muscle. The cauda tympani nerve arises 6 mm approximately from the stylomastoid foramen. So the cauda tympani nerve, which arises 6 mm proximal to the stylomastoid foramen, and it enters the middle ear through the posterior canaliculus and passes between malleus and incus and it again passes through the anterior canalicus to the canal of Ugier. So in this diagram you can see this, it passes through the canal of Ugier and enters the infratemporal fossa, which joins with the lingual nerve to give a sensory supply to the anterior 2/3 of the tongue. So it joins with the lingual nerve and gives a taste sensation to the anterior 2/3 of the tongue. It serves as a landmark for performing posterior tympanotomy, and it forms a lateral boundary for the facial recess. So coming to the surgical landmark, the process cochleoformis, which is a landmark for a geniculate ganglion which lies anterior, and the tympanic segment starts at this level. The oval window is located inferior to the tympanic segment, and the horizontal semicircular canal is which is related to the second genu of the facial nerve. So coming to the extracranial segment, on leaving the stylomastoid foramen, it gives branches to the two muscles. One is the posterior valley of digastric and the other one is a stylohyoid muscle and a post-auricular nerve. So once after exiting through the stylomastoid foramen, it enters the parotid gland at the level of faciovenous plane of Platy and divides into temporofacial and cervicofacial trunk. So again, these two trunks further gives 5 branches, that is temporal, zygomatic, buccal, marginal mandibular and the cervical branches. So these are the 5 branches after exiting from the facial parotid gland. So you can see a temporal branch which innervates the frontalis and orbicularis oculi and corrugator superior cili muscle, and the zygomatic branches and the buccal branches, and the marginal mandibular branch which innervates the mentalis muscle, and the cervical branch which innervates the platysma. So the extracranial landmark being the tracheal pointer and the posterior valley of digastric and the tympanomastoid suture line. So coming to the blood supply, the cisternal, meatal and the labyrinthine segment receives the blood supply from the labyrinthine artery, which in turn branches from the anteroinferior cerebellar artery, which arises from the vertebrophyseal artery. The greater superficial nerve, which receives blood supply from the petrosal branch of middle meningeal artery. So the tympanic and the mastoid segment of the facial nerve receives branches from the superficial petrosal branch and the stylomastoid branch of post-auricular artery. So this is a diagrammatic view of the blood supply of the facial nerve. So you can see this stylomastoid branch which arises from the post-auricular artery and the petrosal artery which arises from the anteroinferior cerebellar artery. Thank you.